Hey guys, Dr. Davin Lim, board certified laser dermatologist. If you've ever walked into a cosmetic clinic and someone's told you that microneedling can decrease your pore size, induce collagen therapy, reduce scars, improve pigmentation, and do a whole lot others, and you buy one and get one free, hit that subscribe button. Okay. For those of you that don't know me, I am Davin Lim. I'm a board certified laser dermatologist, and my specialty is basically anything aesthetic and procedural in dermatology. So I've got good colleagues, Dr. Dre, for example, and Dr. Samantha Bunting, who are excellent medical dermatologists, and together I would like to think all three of us fill the gap. In other words, fill the void of what dermatology really is. And my colleagues help me. And I agree with them in regards to medical dermatology, but when it comes to microneedling, lasers, anything energy device, this is my niche. I wouldn't say it's my world, it's my niche because we all share the same world. Now, microneedling, what is it and why am I talking about it? The reason is this, it's just in the last 1 year, there's been a big spike in microneedling, and with that, I've been seeing a lot. People don't ask me for microneedling because they're way past that. They've had microneedling before, and they come and see me for this acne scarring, but a lot of scarring from microneedling. So microneedling is a therapy by which it is super cheap to actually get into. In other words, for someone who's into the cosmetic industry, you don't need much training. In fact, you just fill out the form, they'll send you a derma pen, a skin pen, an ellipse, an eclipse, or whatever. And then you read the brochure, you watch a YouTube video, and that's it. Most of the time you do not get any training at all. And that's why we see so many. Myself, I see a lot of mistakes with microneedling, but there are a lot of positive outcomes of microneedling. So certainly if you've had microneedling before and it's helped you with your collagen, it's helped you with your mild scarring, your chickenpox scarring, by all means, I'm not there to actually say it's a bad treatment. I'm just here to tell the truth. Okay, so microneedling basically causes CIT, collagen-induced therapy, and CIT can be caused by several things, including skin needling as well, which microneedling devices hate because they say, look, it rips the skin. Yes, it does. If you use big needles, certainly 1mm needles, it does. But if you're using 0.25 needles, you've seen me, you've seen my videos, or you haven't, check out my Instagram, because I show you that with a 0.25 needle, I can make people bleed, which is the end point of microneedling, because that you are in the dermis. As soon as you get pinpoint bleeding, that is the end point, and you can do that achieving a 0.25 needle, which you buy from eBay for $5. Once off, sterile, throw it away. So I'm all for collagen-induced therapy. Microneedling is basically an upsell, okay, and many clinics are doing it. Just have a look, go online, click microneedling, look how many clinics are actually advertising. Buy one, get one free. You know, it's very, very cheap to get into, and the consumables are next to nothing. So for the clinic, it's a profit-making, I guess, venture, because the needles itself cost realistically $2 to buy, all the way up to $5 for a replacement. Sure, derma pen's a little bit more expensive, but you're paying for the brand, the name, and not the actual, I guess, method. Yeah. But that, together with a clinician's time, together with a bit of cheap HAs or lubricants which they put in your skin to slide the needle across. Look, the total cost price of that is $5. They might charge you $50, $100, $150. So you can see the cost-benefit ratio. That's why a lot of people are getting into microneedling compared to lasers, which cost, you know, the really good ones, yeah, upwards of $100,000. So, microneedling, what can be used for? Well, like I said, collagen-induced therapy, or CIT, so it can actually plump up your collagen, reduce fine lines, reduce fine wrinkles. Yes, it can do that. Can it actually volumize your skin? The answer is no, because you're not going to get, for example, 1 mil of filler. You can get an amazing amount of, in the right spot, amazing amount of revolumization in the right person. But can it actually induce 1 mil of collagen, or equivalent of 1 mil of collagen? The answer is no. Yeah, but can it give you better skin texture? The answer is yes, if it's done the right way. So remember, the X factor for all of these things is it's not the actual it's not the actual name itself. It's the person behind the device. Yeah. So you might get someone who's really good at skin needling and who understands that, hey, if this pigmentation is melasma, and yes, there are studies out there saying microneedling can help melasma in up to 38% of patients, but they don't read the fine print. That was actually used with a VEGF, or vascular endothelial growth-like factor inhibitor, right? So they use modulators together with microneedling, combine two different devices, then get an outcome. But people would look at just microneedling, melasma, and advertise that. And in the vast majority of cases, microneedling makes melasma worse, right? So they come and see me, next thing you know, the epidermal, if you think about it logically, so let's go through logic here. You've got pigmentation in the upper part of your skin, the epidermis, yeah? And then what happens is when you microneedle, you push it down and then it becomes dermal melasma. And nothing's going to shift that except lasers, T-acid tyrosinase inhibitors. Okay, so where am I leading to? And this is where I'm leading to, acne scarring. So can microneedling help acne scars? The answer is yes. So if you have mild acne scarring, if you have monomorphic acne scars, if your scars are actually non-tethered, yeah, and mild, and you get it early, anything can help, yeah. Fraxel 1927, Fraxel 1550, non-ablative lasers, Picogenesis, PicoSure, my studies on the E-matrix 7 years ago, even RF microneedling, yeah, subablative, they all work, right? So if you get acne scars early enough, you can demonstrate a good improvement. In fact, just check out this picture now, yeah? This is severe acne and acne scarring. And look at this picture now. What did I do? This picture's over 10 years old. Have you guessed what I did? Nothing. Absolutely nothing. I just treated it as acne. And his immune system did the rest. So I used anti-inflammatories, yeah? And I gave him a good course, a good dose, actually decreased the inflammation quickly so he didn't scar. And obviously added some mild isotretinoin. In other words, your Accutane, but at a very low dose, 5 milligrams per day, and increase accordingly. So you can see, look at this picture before, look at it after. I did nothing, no scar revision. And this picture was taken, you can see the time flag there, where I used to work at Westside Dermatology. That was taken about 11, 12 years ago, okay? So guys, you can see that microneedling can help, but will it help all of these different type of scars, right? So will it help atrophic scars? Will it help tethered scars, anchored scars, rolling scars, ice pick scars, deep box scar scarring, broad box scar scarring, linear scars, hypertrophic scarring? The answer is no. It's not the be all or end all. It's basically blanket cover and good luck. So the science behind it, yes, it is there. It induces basically collagen remodeling. When you hit a scar, it causes the scar to break, it causes cytokine release, and it causes CIT, as the name suggests, collagen-induced therapy. It causes the fibroblasts in the absence of inflammation, so if you don't have active acne and everything's quiescent or quiet. So in the absence of all that, yes, it can actually remodel the scar. However, if you look at my videos, these are time-lapse videos of what I do. Do I use microneedling? Yes, I do. Do I prefer manual microneedling? The answer is yes, because I'm actually, instead of using a device, I'm using my hands, I'm using my fingers, I'm using feel, I'm using touch, yeah? And I'm going to each scar, especially the forehead scars. I love doing microneedling in forehead scars, especially temples and forehead, because I can hear that crunch. I call it a crunch noise, yeah? So for all you guys who've had microneedling by myself, you would know I say, hey, let's embrace the crunch. Let's listen for that crunch to see whether the scar's atrophic or whether it's tethered. And as soon as I hear that crunch, I know that microneedling has worked, yeah? And I often use a buffer for that. And most of the time it's saline. So do I use it? Absolutely, but only in those circumstances. And you look in my videos, you see I use every patient is different. So I get the question on Instagram a lot. That's why I say, hey, If you guys aren't following me on Instagram, please do, because I can cover a lot more, because there's so many scenarios, hey? So we were talking about acne scarring in, for example, dark skin individuals, atrophic acne scarring, ice pick scarring, box scar scarring. These can all be addressed. There's so many different combinations, and I can't talk about all these combinations on YouTube. Sure, do I prefer YouTube to learn? Yes, I do, but I can also give you added information and tips on Instagram. So that's why I say, if you're not following me on Instagram, you'll learn a lot more in regards to treating acne, preventing acne, and treating your scars. So it's Dr. Davin Lim, that's my Instagram account. Okay, so I'm still on YouTube, I'm still here to stay, but I'm just telling you it's easier to do that. So what am I on about? Acne scar revision. Yeah, so you can see all these time-lapse photographs. Each and every patient has a bespoke treatment. So I'll be there using all these different methods. I'll be using my cannula subcision, which I find the best because it's a manual method, yeah? So it's not if the scars will break. The scars will break. The scars will break because I'm there breaking up the scars, and you can feel the scars actually break. So it's targeted scar revision. It's not good luck with a microneedle and let's hope we hit something. If you think about this, and you, once again, if you consult me, I always give you the same analogy. If you think about a scar is basically a rope or a wire holding the epidermis, which is the top part of your skin, which is, it's my analogy, is the roof, to the bottom part, which is your subcutaneous tissue, usually in the mid-fat layer, which I consider the floor, and it's like a rope pulling down. So if it's a rope pulling down, what is the logic about delivering vertical systems like lasers and microneedling to try to break down that rope? I go in horizontally or obliquely using Subcision, and it just cuts the rope. Easy as that. I don't have to hope to hit something. I'm actually hitting something because I'm going horizontally. Does that make sense to you guys? Because acne scars attach from the top to the bottom. That's why you get the pucker, that's why you get the scar. So I don't see the logic in that, but yes, I do from a consumer point of view or from an industry point of view, because it's much easier to invent a laser than to teach someone skills as to actually treat their scars without hitting vital things like your parotid gland, your facial artery, and most importantly, your facial nerve. That's a good $15,000 mistake, of which you might undergo 5 or 6 hours of plastic surgery, yeah, just to get your nerve attached. So that's why I guess manual revision is so hard, and that's why many doctors avoid it. It's because yes, there are risks, and yeah, it takes many years to actually learn the skill sets. So guys, look, the bottom line is this. I'm not against microneedling at all, but if you're going to use it for medical reasons, and medical reasons are these, there's 2 medical conditions which I guess am really passionate or am concerned about. Number 1 is melasma, we discussed that. Number 2 is acne scarring. So if acne scarring is mild, which means it cannot be seen at conversational distances, yeah? So if I'm talking to you and the scars can't be seen, but the scars can only be seen on angle lighting, or if it's really, you know, like, oh yeah, I've got a scar up there, for example, yeah? So that's conversational distance, and this is not. So if the scar is visible at conversational distances or even further, you know, it might even be, a lot of the times I see my average patients is actually 12 times conversational distance, yeah? So it's at 6 meters I can see the scar. So that's my average patient. Sometimes it's even at 10 meters, which is 50 times conversational distance. Conversational distance is defined as 50 centimeters. So if your scars can be seen at conversational distances or above or beyond, that's medical, yeah? And in my opinion, before you get microneedling, you should always get a statement, just like when you get a statement from me when I treat your scars, because I give you a minimum and realistic improvement, of which if I don't meet, my name is, I guess, rubbish. because I've got expectations of which patients all over the world come and see me, and I've got to meet their expectations. So in that letter, which I always give to every single patient, I would state, dear, Mr. Smith, thank you for seeing me. Examination today reveals that you have box scar scarring, icepick scarring, rolling scars, tethered scars, hypertrophic scarring. These can be seen at a distance of, and I might put, 3 meters. They can be considered as grade 4B by the Goodman-Barron scale. Realistically, after 6 treatments over the course of the year using various techniques such as subcision, no-core subcision, microneedling, RF together with low density fractional laser, one would expect a minimum of 70% improvement from baseline. So I take the photos, I state the actual minimum improvement that the patient will receive, and that's my letter of authority to the patient. That's my promise to that patient. Now, if I don't meet that 70%, and the patient did undergo 6 treatments over the course of the year, I have an obligation to actually meet that 70% because I wrote that. Sometimes you'll even hear me say, I can, seriously, treat scars up to 95%. I never give you 100% because that's unrealistic expectations, and I might miss 1 or 2, or because I'm human, or those 1 or 2 are just resistant to treatment, and I might make it worse by actually doing another treatment on you. So you'll always hear me up to 95, 98%, but never up to 100%. But when I give you those variances between 70 to 90% or 95%, I have to keep my promise because that's written down. Now, if you pay me that amount to treat your scars as a specialist dermatologist, I have to deliver the outcomes. If I don't deliver the outcomes, like I said, it's bad because it's bad both for the specialty, it's bad for my name, and it's not good medicine. So I expect clinics to do the same. If you're going to treat people with microneedling, you've got to give them realistic expectations. You've got to assess their scars, tell them what kind of scars they have, grade their scars, all you guys know the Goodman-Barron scale. So grade their scars, tell them what kind of scars they have, photograph them, look at them from angle lighting, palpate the scars to make sure they're not fibrotic or have subdermal fibrosis. Treat them, but before you treat them, you've got to give them, hey, we're going to improve the scars by a minimum of maybe 30% with 5 or 6 sessions of microneedling. Plus or minus PRP. And if you look at those photographs, they have to have an improvement of 30% objectively. Yeah, so not subjectively, it's objective assessments. And if you don't, you've broken the promise, and that's not good medicine, okay? So once again, no problems at all for clinics doing microneedling, but you've got to understand the limitations of this particular procedure. Not all scars can be treated with microneedling. In fact, if you look at the attachments of where scars are, they're actually attached to, believe it or not, I just can't see the logic in this. In all these years that we do, that I've been in scar revision, we talk about lasers, their outcomes, the whole lot, how lasers work, how many mils they penetrate into normal skin, luminous, 2 to 3 millimeters normal skin. Why are we treating normal skin? What relevance has it got? 0. We're treating abnormal skin, so can you give me like a figure for that? But why don't we take histology? Why don't we go back to the basics and see where the scars are attaching, what scars are, and then actually work from there? So in my recent studies I've done, which will be published next year, it's showing where the scars attach, and the scars attach in, believe it or not, the mid-fat layer, right? So we're treating scars that attach in the mid-fat layer to the dermal layer, and some of them actually attach to the SMAS, which is basically the layer just above your muscles, which encompass all your muscles. So that's why when you animate, when you smile, the scars actually dimple in. So, and that's the layer you got to go to. So basically I'm challenging the paradigm, and it's true. I do dermal testing nowadays because all those stories about, you know, therapy melting fat and RF melting fat and lasers melting fat, I used to be like all the other dermatologists and just go, that doesn't happen, that's crap. Why? Because the laser company tells me so. Because when I hit, you know, skin with the laser, I know. But I don't believe that anymore. I believe that if you do actually hit someone with a thin dermal layer with a really powerful device, yes, you will melt fat. Therapy will melt fat. If you double or triple pulse at 3.5 mils and someone's got a thin dermis, you will melt fat. And you'll do the same with Infinity, and you will do the same with something like Scar FX or Deep FX with UltraPulse, because they do have that power to actually melt fat. So it's challenging the paradigm of what I guess we've been taught, but challenging it in a way which is scientific, which is what I do. That's why I'm kind of controversial. But I do deliver the outcome. So if you have, when you see me or see any of the other dermatologists, they should give you actually a percentage improvement, a minimal percentage improvement. So guys, thanks very much for watching this video. And like I said, if you're not on Instagram, please, please have a look, because I can deliver so much more information. How to use retinoids, how to titrate, hormonal acne, foods to avoid, a whole heap, not just acne scarring. And yes, I still do prefer YouTube to deliver this information, but Instagram just adds a little bit more. So guys, there's my whole summary on microneedling. If you'd like me to go into some more detail, I can spend another 20 minutes, even 30 minutes talking about microneedling and the science of it. But all I'm saying is that keep it safe. It's the X factor that counts. And by all means, don't get scammed into, you know, buy one, get one free packages, because packages don't work. If you think about it logically, if you keep treating the same scar with the same treatment, will it go away? No, it won't. You need to adapt. That's why you see me, hey, Davin, what's a treatment plan? I'll give them a treatment plan, but I say, look, at any time I'll change it, because if your scars are still there, I have to adapt. I'm going on too much about scarring. That's my passion. Maybe I should do, hey guys, try me your thoughts below. Maybe I should do a, what do they call it? YouTube Live. I think, yeah, YouTube Live. I did one, maybe Instagram Live or YouTube Live in Beverly Hills a couple of months ago, but I don't know how it works. But if you want me to do a YouTube Live, just chime your thoughts below, and I'm happy to arrange a time as I'm operating, and you can see what I do, and I can answer your questions, okay? But a lot of the questions can be found on acne.org, or if you go to Real Self, I can answer them there. I can't answer personal photographs because they're inaccurate from a medical legal point of view, but certainly guys like BA from acne.org, amazing knowledge. He's got more knowledge than probably your dermatologist has, okay? So guys, I hope this video has helped you in regards to the questions in regards to microneedling, and if you can take away one thing, it's this: ask the clinic to give you a written promise, because I do, and that's how it should be done. Thanks guys for watching. Please subscribe, and I'll see you on Instagram or YouTube. Bye for now.